Well, Dr. Wachira, thank you for making time for this discussion today. And maybe we should start off by asking, what is oral health?
Yes, thank you for the invitation. And just to introduce myself, yes, my name is Dr. Wachira, and I'm the resident dentist at Elephant Dental Clinic at Corner House.
Mm-hmm.
And thank you for the invitation again.
Wow, that
Yes.
is a good one.
Like you've introduced it, oral health. The key word is health. Health, the definition of the word health would be lack of illness or injury
Mm-hmm.
in whichever part that we are going to be discussing about. But
Mm.
in this scenario, oral health. So again, if you add the word oral now to the health,
Mm-hmm.
the definition would be lack of injury or any disease state
Mm-hmm.
in any of the tissues in the mouth, in layman language here.
Mm-hmm.
But the word oral again, they are in the mouth. We don't just discuss teeth only.
Yeah.
There is the hard and the soft tissues in the mouth, and even generally around the mouth. The
Mhm.
lips also are included in this. So lack of any disease state that will hamper your ability of chewing,
Mhm.
smiling, psychosocial well-being, because well, yes, you do require the teeth to smile,
Mhm.
and that's
Mhm.
psychosocial.
Yeah.
So lack of any state that will hamper any of those
Mm-hmm.
abilities, yes.
Okay, so lack of any disease in your oral I wanted to say oral area, but in your mouth basically. And you're pointing out very clearly that it's not just a matter of your teeth. You talked about the
Yes.
gums and the soft tissues. So maybe just tell us kidogo to scientifically the composition of your oral of your mouth of your mouth.
Well, in the mouth, if you were to broadly classify the tissues in the mouth, we would say they are hard and soft tissues.
Mhm.
Hard tissues in the mouth will go for the teeth.
Mhm.
Any disease state that affects the teeth, be it caries, be it trauma to the teeth,
Mm.
that's for the hard tissues. For the soft tissues, there are conditions that affect soft tissues.
Yeah.
Soft tissues in the mouth, we have the tongue itself,
Mhm.
there are the gums. So any condition again that affects
Mhm.
those areas, it's part of the well-being of the mouth.
Okay, now, we want to talk about the issues hygiene, and I know this is something that affects a lot of people, either directly or indirectly. And I'll try to
Yes.
to explain why I'm saying indirectly. When you are not okay, when your oral health is not okay, it will affect me as a person. So we'll start with the most common activity that we do in the morning, or every morning and evening. That is brushing our teeth. So, from a professional perspective, what is the right way of brushing my teeth?
Yes, maybe just on a lighter note, nowadays not everyone wakes up to brush their teeth. Some of us wake up to first of all look at our phones and do all those kind of things first.
Yes.
So yes, for brushing our teeth,
Mhm.
it's an area that majority of us assume that we know
Mm-hmm.
how best to go about it.
Mm-hmm.
And this is because the majority of us just assume again that brushing our teeth is just a matter of holding your brush and
Mm-hmm.
just doing rounds in the mouth
Mhm.
anyhowly
Mm-hmm.
and then rinsing, and you think you're done with it.
Yes.
Because yes, again, you'll go to your dentist and you'll ask your dentist, how comes I'm having cavities
Mm-hmm.
and I brush 2 to 3 times every day?
Yes.
And I'm sure your dentist will simply tell you, it is not just a matter of brushing, it's also a matter of brushing the right way.
Mm-hmm.
So, how to brush? First, there is the duration that you should
Mm-hmm.
take when brushing.
Uh-huh.
We say two to 3 minutes is good enough
Mm-hmm.
if you're doing it the right way.
Mm-hmm.
Again, doing it the right way does not involve using all your muscles to brush.
Mm-hmm. Si ile unashika toothbrush ni kama unakata nyama, you know?
No. If
Uh-huh.
you're brushing in the regular intervals, that is, we normally say minimum twice a day.
Mm-hmm.
In the fast-moving world, majority of us, over lunch hour,
Yes.
some of us, we're not at home.
Mm-hmm.
But at least twice in a day, morning after breakfast, evening after
After
having your
dinner.
dinner.
Mm-hmm.
If you're doing it at those 2 intervals, there is no need to use all the muscles on your hands.
Mm-hmm.
You use all the muscles on your hands, you will injure yourself
Mm-hmm.
and attempt to clean your teeth.
Mm-hmm.
How to do it again? So just a matter of putting your brush in the mouth and doing rounds.
Mm-hmm.
Sometimes you just have to show that you're covering all your teeth,
Mm-hmm.
and still not just anyhowly. There is the right way of brushing.
Mm-hmm.
Some of those things are best demonstrated by a health profession, that is a dental health profession, up close. In majority of facilities, we have models on our desks,
Mm-hmm.
which when we're discussing your oral health, will show you how best to brush your teeth.
Mm-hmm. Okay.
Yes.
So see muscles too evil. But there's someone who said sometimes we cannot get to the very far end of our teeth and all that. So maybe for someone who is having this challenge, what can you advise them to do when brushing their teeth?
Well, to get to the very back of your teeth,
Mm-hmm.
if you note, when you open wide,
Mm-hmm.
your brush cannot go on the outer aspect of your very
Okay.
last tooth.
Mm-hmm.
That is if you open very wide. Because when you open very wide, the muscles on the sides of your jaw tend to close in on that region.
Mm-hmm.
So if you want to get the very last tooth, how you do it is when you put your brush in your mouth, try close a bit
Mm-hmm.
to create room on the outer side
Mm-hmm.
of that tooth.
Mm-hmm.
So like I said, it is not just a matter of just putting the brush in the mouth and doing rounds, and sometimes you're not even concentrating.
Yes.
Sometimes you're brushing as you talk.
Mm-hmm.
You need to take time, and especially for those very last teeth,
Mm-hmm.
when you're brushing the very last tooth, try close a bit. Then now your toothbrush can get some space on the outer side
Mm-hmm.
of that tooth, and you can be able to clean that area also.
Mm-hmm.
So yes.
All right. And what about our tongue? Because when I was growing up, I'm not very frequent when it comes to visiting my dentist, and I am so not very up to date with my appointments. But when I was growing up, my mom used to tell me that if you've not brushed your tongue, then you've not brushed your mouth. You've not brushed your teeth at all. I don't know, what is the relation between brushing your tongue and your teeth?
When you're brushing your teeth,
Yes.
we say technically you brush your mouth.
Mm-hmm.
That is all the tissues in your oral cavity.
Mm-hmm.
And the tongue, yes. If you look at the tongue, it is not a smooth surface.
Yes.
So it very easily accumulates debris.
Mm-hmm.
When you eat, and especially, let's say when you eat any that has food additives,
Mm-hmm.
you'll notice that with time, your tongue will get a tint,
Yes.
yellow, depending on, well, what you've been adding to your diet.
Mm-hmm.
So yes, you have to clean your tongue also. And your tongue, you can hold your tongue at the anterior region.
Mm-hmm.
Then you're able to very, very easily clean your tongue. The only issue with cleaning the tongue at the back, there is a bit of discomfort.
Yes.
Some people gag very easily. So you have to be a little bit gentle as you clean the tongue. The anterior region, very easy to clean. But at the back, there's a bit of discomfort. So you just have to be a little bit gentle on how you do the cleaning in that region.
Okay. And you said that, and I remembered, what about for the young babies and the newborn babies? Are we supposed to brush their teeth? Okay, not their teeth, their mouth and their tongue. How are we supposed to go about that?
For the newborns, brushing using a brush is a bit of a challenge. So we always advise the moms, because when the baby is suckling, if you let the baby just run without trying to wipe or clean their teeth, you'll notice with time, well, they might even develop a bit of bad breath in quotes. What we advise is, even as soon as the teeth start erupting in a newborn's mouth, try get a clean piece of cloth, which you can be using to wipe the teeth. And especially, because babies will be suckling, then they even sleep.
Yes.
So majority will not have their teeth or their mouth wiped. So you just have to be a bit careful how you do it again. Such that the child does not go the whole day without having their teeth white.
Mm-hmm.
Again, we also advise as soon as the first teeth appear in the mouth, get a dentist in the picture. Someone who can guide you through the eruption sequence, someone who can guide you on how best to take care of those teeth as soon as the first teeth appear in the mouth. So yes, they need to be white.
So it's not right to actually assume that since ni mtoto mdomo yake ni safi, or you should not tamper with that. It's advisable to wipe using a clean piece of cloth, if I'm getting you right. And
Yes.
and still talking about this issue of brushing our teeth, what is the right time, or rather what is the right duration of using the same toothbrush? How often should I change it?
A toothbrush, we recommend you should change your toothbrush every 2 to 3 months. And why so? Once you've used the toothbrush for that duration, 2 to 3 months, you will realize that the efficiency of that toothbrush, the bristles, they either worn out, or you realize they're frayed. They're starting to, quote unquote, spread all over.
Yes.
By that time, you'll be forced to use a lot of force to get the efficiency that you want when you're brushing your tooth
teeth.
surface. And the more force that you use when you're brushing, the more injury you cause to your gums in this scenario. So to avoid all that, and again, by the time you're using a toothbrush for 2 to 3 months, it has accumulated bacteria within the bristles. So to avoid the infections in your mouth secondary to what is on your bristles, we advise change your toothbrush every 2 to 3 months.
Every 2 to 3 months. I once went to my Ushago, and I came across this toothbrush that I don't even know how to describe, but for lack of a better word, it was old. And the bristles were so faded, they were so soft, and even the plastic surface literally had started to fade off. And I'm imagining it's not only in my Ushago that you will find this kind of toothbrush. In most people's homes, there's just that old toothbrush that people do not want to let go of. And on that note, I want us to talk about the right qualities of a good toothbrush. See, it's not that I should just walk into a shop and get any kind of toothbrush. What is the best qualities?
Yes, for a toothbrush, again, I will always advise get one that has soft bristles. Bristles are the small sticks on the brush.
Yes.
Get one with soft bristles. Why soft? You don't want to injure your soft tissue, that is the gums. Because yes, as you're brushing, the bristles will get to the gums. And when the bristles are too hard, they'll cause injury to the gums, which will cause what we call gum recession, which will expose a part of the tooth that should not be exposed to the oral environment, which leads to issues such as sensitivity. So a soft toothbrush, again, the size. The size, well, I'll say it depends with your mouth.
Yes.
Some of us have a small mouth, others, well, like myself, you have a big one. So depending on the size of your mouth, you'll check on how big a toothbrush you should get. For the young ones, a small one will help them. That eventually they can be able to be initiated on how to brush well, how to use it. So yes, soft toothbrush, the bristles should be soft, so that, again, you should not use too much force when you're using the soft toothbrush. There'll be no injury to the soft tissues, and as that, you'll not cause any harm to yourself.
Okay.
Yes.
And what about my toothpaste? What about the toothpaste?
For the toothpaste, we normally we'd look at the ingredients of a toothpaste, for example. Majority of them nowadays, they have a flavor, which is meant to, quote unquote, even make the young ones enjoy brushing.
Yeah.
Majority of them, they have fluoride. The fluoride is meant to help the teeth to avoid having cavities very easily.
Yeah.
So for the toothpaste, again, I would say go for something that has fluoride in it. For the flavors, for the flavor, it's up to you.
Yeah.
So long as there is fluoride in the toothpaste, and you're brushing at the regular intervals. For the branding, well, I've not seen anyone of my colleagues trying to go for a specific brand.
Yeah.
not unless now you come with specific, complaints. Like let's say you're having sensitivity, I'll have to lean towards something that will help you with that kind of situation.
Okay.
But otherwise, majority of them, you find that the components are normally the same. So
All right.
they should all help.
Okay, I want to paint this picture of I am sure so many people have come across this. You walk into a matatu or you walk into your office and there is this person whom you do not want to sit next to. Reason being, they have a smelly mouth. Yani, Washira, I want to talk to you and you face aside. You do not want to associate yourself with me whatsoever. And this is because of the breath that I have. Really, really, really. What causes people to have bad breath?
Well, for the issue of bad breath, there are various causes for the same. One of them being what you ingest, first of all. There are people who are like, I would say they have habits like smoking, for example. Majority of them, you'll always find that they have that smell. Let me use the word smell.
Yes.
Bad as it is. Another common cause for the condition that you're calling bad breath is dental cavities. Why cavities? Cavities will act as a reservoir for the food that you eat. And eventually, after staying in the mouth for that long, you'll have the issue of halitosis. Another issue that can cause bad breath is saliva production in the mouth, which can be caused by even some of the drugs that some people are taking.
Yeah.
Conditions. Reduced saliva in the mouth will mean that there is reduced clearance of all the debris you have in your mouth. So in most cases, you have people having halitosis in the morning because of the reduced saliva in the mouth at night. Another thing that can bring about bad breath is gum disease.
Yeah.
Why gum disease again? Secondary to gum disease, you find that there are what we call pockets around the tooth that will again act as a reservoir for food debris. And secondary to all that that the food debris has in the mouth, you'll again have bad breath. Another common cause for bad breath is that you find that some clients will get what we call reflux, chronic reflux from the stomach, which can again lead to the bad breath. But we always advise for someone who complains of bad breath, first we'll ask, has someone told you that you have bad breath? Or it's you who thinks that you have bad breath?
Because sometimes it just happens and you think, manze, and then you end up doing, that's how we do. And if you feel like your nose is complaining, then definitely, I need to brush.
Yeah, that's what I'm saying. The first question that I'll ask you, has someone told you you have bad breath? Because there is the issue, there is the condition we call halitophobia. Halitophobia is basically, you're afraid of having bad breath. So you tend to be overly conscious. You keep trying to check, is there anything? Is there anything? So then there is also what we call psychogenic. Get me?
Yes.
Halitophobia. Whereby it's just in your brain that whenever you talk to someone and you try to assess and you realize that they're looking away from you, you're worried that it might be your breath. So the first question is, has someone told you that you have
bad breath?
Before we get do all the other assessments.
Yeah. And
so, yes.
And if I'm getting you right, and correct me if I'm wrong, sometimes we might just think that bad breath is caused because of lack of brushing our teeth, and there might be an underlying health issue that is affecting our bodies.
Yes, like I said, people have there's a condition like we call GERD, gastroesophageal reflux, whereby content from the stomach, you find that there is that, I'll use again the word that you're using, bad breath, but it might not necessarily be from your mouth, might be all the way from your stomach. Sometimes you also have ENT issues to do with your nose, infections and all that, which can make you perceive like you have bad breath. So yes, you can go to a dentist to rule out any dental issues, anything that in the oral cavity that can lead to halitosis. And if all those are ruled out, then you can be referred to either an ENT specialist or any other physician that can also rule out any other bodily condition that can bring about the bad breath or halitosis, that is.
Okay. Well, let me ask you, as a professional, is it right for me to keep flossing very frequently and at the same time use a mouthwash? Is it right to do that?
Flossing is something that we advocate for very highly. Reason being, maybe unknown to everyone, there is space between teeth. Teeth are in contact, yes, but there is space below those contact regions. And well, food will always tend to stick to those regions, and the bristles on your toothbrush will not get that food debris.
Yes.
And left there, it will lead, even what we're discussing again, halitosis. It will lead to gum disease. So, due to the fact that when you're brushing, you might not get to those regions in between your teeth, we advise that yes, use the floss to get rid of whatever might be stuck in between your teeth. I said floss, not toothpick.
Yeah.
Toothpick should be used on top of the tooth, not in between teeth. Floss is for the regions in between teeth. Toothpick is used to remove whatever might be stuck on the valleys and grooves on mostly your back teeth.
Yeah. Okay.
Yes.
Okay.
That's why you
And
yes.
And I feel like this is where most of the people actually have a discount, you know. And people use toothpicks to try and press in between the teeth, and this is where now the floss should come in and not the toothpick. I hope you got that right, because I know this is a mistake that all of us make. Well, there is another thing that I want to ask from you. You see, when you go to our rural areas, my grandma would chew the bark of a tree or a small branch of a tree and use some ash to brush her teeth. And I've never had her complain of cavity. These alternatives, are they right?
Well, from a medical point of view, I'll when I'm advising my clients, I will not advise them to go, to the rural areas and get those trees,
Yes.
or the ash, or even the other issues that sometimes we get clients coming and telling us or asking whether they can use charcoal to bleach their teeth or to brush their teeth. Personally, I will go for what is medically proven
Yes.
to work. So when I'm advising my clients on how best to take care of their teeth, I will not tell them that, when things are hard and you cannot replace your toothbrush after 2 to 3 months, just rush to your rural area and get that magical tree.
Yes.
No. I'll always insist on what is right. Yes. That is what I know is medically proven to work. As for the ash and the tree, I will not tell a client that yes, my grandmother was using it and well, she had her 32 teeth at her age of 90. No, I will not do that.
Okay. All right, sawa. Well, before I let you go, I would like to know from you, how often should I visit my dentist? What is the frequency? Ama tungoje tu paka unasikia kauchungu kwa meno, that's when you should visit?
Well, it's a habit that many have employed.
Yes.
Not just for dental. We always wait until we've not slept. That's when in the morning you come just asking for an extraction. Dental appointments should be regular, and I always tell my clients, for a healthy or For healthy person who does not have, let's say, any underlying issues,
Mm-hmm.
you should visit your dentist every 5 to 6 months.
Mm-hmm.
But that interval is not engraved in stone. And what I mean is, should you come to me for your first visit,
Mm.
and I realize you've not been taking good care of your teeth, I will not tell you to see me in 5 to 6 months.
Mm-hmm.
I might tell you to even see me in a month or two,
Yes.
as I try to check, have you changed your ways?
Mm-hmm.
Have you been implementing what we talked in your first visit or your second visit?
Mm-hmm.
Then after that, when I realize things have changed or have improved, I'll tell you, yes,
Mm-hmm.
you've improved, so maybe I can give you 3 months now,
Yeah.
until eventually we get to the 5 to 6 months interval,
Mm-hmm.
dental checkups.
Mm-hmm.
Again, for pediatrics, that is babies, they cannot have their dental appointments every 5 to 6 months.
Yes.
Reason being,
Mm-hmm.
children need regular intervals. Reason being, again, how they take care of their teeth, you cannot compare to a full-grown adult.
Mm-hmm.
So for children, again, because they are going through different phases, there's the eruption, there is new teeth,
Mm-hmm.
and so for all that, for us to work with you through the eruption sequence,
Mm-hmm.
we might see you sooner.
Mm-hmm.
So again, for the 5 to 6 months, it is not engraved in stone. Every situation has its own.
Mm-hmm.
You come to me, things are looking superb, your smile looks okay, I'll tell you yes.
Mm-hmm.
I'll see you in 5 to 6 months.
Okay.
If you come to me, things are really falling apart, I'll not tell you to see me in 5 to 6 months.
Yeah. So it depends with
I'll
the
tell you, see me
situation.
sooner so that you...
It depends with the
Yes.
situation. Okay. Well, I must say thank you so much, because at least now we know how to take care of our teeth and not to use the same toothbrush for 5 months. Well, I am grateful. Thank you so much and have a beautiful evening.
More of our shows, log on to www.familymediaonline.com to enjoy a wide variety of programs, from current affairs to testimonials and features, pastoral and inspirational shows, kids entertainment, and so much more. Also stream live on www.familymedia.tv.